Okay, today I will explain the journey of Technetium-99m, which is the most widely used radioisotope in nuclear medicine. Okay, let's start. From the beginning. Okay, Technetium-99m is obtained from molybdenum-99. Technetium-99m generator after elution with normal saline. Okay, we obtain sodium pertechnetate, okay, which contain Technetium-99m in solution. Okay, we get sodium pertechnetate in solution. Okay, if we inject this pertechnetate directly into the patient without any modification, it will naturally accumulate in specific organs such as the thyroid glands, salivary glands, stomach, and mecal diverticulum. Okay, therefore, it can already be used for this measuring this organs. Okay, however, if we want Technetium-99m to reach other organs such as bones, kidneys, heart, or the brain, it needs a guide. Okay, this guide is a pharmaceutical compound that directs the radioactivity to the specific target organ. Okay, this process is called radiolabeling. Before labeling can occur, an important chemical step is required. Technetium leaves the generator in the oxidation state +7, okay, as pertechnetate. In this form, it doesn't bind easily, okay? So therefore we add Stannous Chloride, which act as a reducing agent. It reduces technetium from oxidation state +7 to lower, okay, technetium +4 or +5, okay, allowing it to form stable complexes with pharmaceutical compounds. Okay, once radio labeling is completed, Technetium-99m can be directed to different organs depending on the compound used. Okay, for bone imaging, Technetium-99m is labeled with MDB. Okay, this compound has a strong 4, okay, for attached in bone tissue. Okay, as a result, it is widely used for detecting bone metastasis, fractures, infections, and area of increased bone activity. Okay, for kidney, okay, find two guides. Okay, DMSA and MAG3. Okay, DMSA, okay, taken up by renal cortex, okay, used for renal scars, okay, or cortical imaging, which passes, okay. The second is MAG3, which passes rapidly through the kidney and is used to evaluate renal function and urinary tract obstruction. For cardiac imaging, Technetium-99m is labeled with Sestamibi, okay, also known as MIBI. This compound accumulates in veal myocardial tissue according to blood flow. Okay, therefore, it is commonly used in myocardial perfusion imaging to assess coronary artery disease and myocardial ischemia. Okay, for brain imaging, okay, technetium-99m is labeled with HMPAO. Okay, this radiopharmaceutical can cross the blood-brain barrier and is used for perfusion studies. Okay, stroke evaluation and some brain disorders. Okay, before any radiopharmaceutical is injected into a patient, quality control must be performed. One of the most important tests in the measurement of radiopharmaceutical purity or RCP. This test determines the percentage of technetium-99m that is correctly bound to the pharmaceutical compound compared to free technetium. A high radiopharmaceutical purity indicates a safe and reliable radiopharmaceutical, which ensures accurate diagnostic imaging. Okay. In conclusion, technetium-99m started as a simple pertechnate solution, but through radiolabeling, it can be directed and reach to a lot of organs. Okay. Just this. Thanks.